If you're watching this, you or someone close to you might be facing surgery for endometriosis. And whether it's your first surgery or you've been down this road before, knowing what you can expect can make a world of difference. So hi, I'm Brooke. I'm an obstetrics and gynecology doctor, and I'm here to guide you through the things that we don't talk about enough. In this video, I'm going to walk you through the entire process, why you might go for endometriosis surgery, what the surgery actually involves, what happens on the day, how long that recovery might take, and the little things that can help you to heal more comfortably at home. We're going to finish up by talking about some tips if you want to get pregnant after your surgery. So what is endometriosis surgery? Why do we do it? Well, endometriosis is a condition where the tissue that is similar to the lining of the womb grows in places that it shouldn't, like on the ovaries, fallopian tubes, bowel, or your bladder. This can all cause inflammation, scarring, and pain. It can also lead to problems with your fertility. So if you've got painful periods and you think that you could have endometriosis, watch this video for some more information. Surgery might be recommended if you've got severe pelvic pain that hasn't improved with medical treatments, hormonal treatments, or you just don't want to try medical treatments. Surgery might also be recommended if you've got signs of severe endometriosis on your scans, like your ultrasound scan or your MRI scan. Sometimes we recommend it if you're having trouble getting pregnant, or if there's an endometrioma, which is a cyst on the ovary that's specifically caused by endometriosis. You also may choose this option if you've tried other treatments but the symptoms just keep coming back. Now, the aim of surgery is to remove or destroy the visible areas of endometriosis and to free up any of the organs or tissues that might have become stuck together due to scarring, so adhesions. Now, planning your surgery carefully really matters. It's not a one-size-fits-all operation, and depending on the extent and the location of the disease, your surgery may need to be performed by a specialist endometriosis team, and sometimes it can be planned as a multidisciplinary procedure, meaning we've got to involve bowel surgeons or urology surgeons too, and in more complex cases we might even need to do a stage or a two-stepped approach where we do different areas of treatment and different operations. It's also important that we plan the timing of the surgery carefully. Sometimes it's better to delay the surgery, not rush into it, and instead manage your symptoms with hormone medications, not meaning that you can never have surgery, but just delaying it until maybe the time when you're planning to conceive, because then your surgery can be done close to the time when you want to get pregnant, so it can have that maximum benefit for you. Then surgical technique also matters. Now, while most of our procedures are done laparoscopically, we have robotic assisted laparoscopic surgery, which can be used in some places for added precision. It can be particularly helpful for deep endometriosis or when we're operating near delicate structures. Your team can help to decide what's right for you. So what happens during endometriosis surgery? Well, endometriosis surgery is usually done under general anaesthetic and using a minimal access approach, so laparoscopy, meaning keyhole surgery. A small camera is usually inserted through a tiny cut near your belly button, and then we use other instruments that are inserted through additional small cuts in your lower abdomen. We fill up your tummy or abdomen with gas to be able to see clearly, and then the surgeon will look inside the pelvis, and if they find any endometriosis there, they may excise it, so cut it out, or ablate it, meaning burn it away. Excision is often preferred if it's in an area that we can safely cut it, because it gives a more complete removal and helps with long-term pain relief. They may also drain or remove any ovarian cysts at the same time, carefully break up any scar tissue from the inflammation, and separate any of the organs that might have become stuck to each other. The number of incisions depends on how much work actually needs to be done, but most people will wake up with 3 to 4 small dressings on their tummy. If your surgery is complex, it may be done by a specialist endometriosis team, and that can make a big difference to your outcome. The procedure usually takes between 1 to 3 hours, depending on how much disease is found and being treated. Now, what can you expect after surgery for endometriosis? Well, usually you wake up in a recovery area feeling a bit groggy, sometimes with some soreness around your tummy. It's very common to feel some soreness or tenderness also up to your shoulder because of the gas. Most people can go home the same day, but if your surgery was extensive or if it involved your bowel, your bladder, or other organs nearby, you might actually stay overnight. So, common things that you might experience do include, as I mentioned, shoulder tip pain from the gas used to inflate your stomach, cramping or bloating for several days, bleeding or spotting from the vagina. Sometimes we put a little manipulator into the vagina to help to move the womb around, so that might cause a little bit of bleeding afterwards, even if you weren't expecting your period. You might also feel tired or emotional. That's completely normal. You'll be given some pain relief, and most people wake up and are walking within hours of their surgery, but a full recovery can take some time, even longer than you might expect, especially emotionally. You might think because you're back on your feet and you're sent home the day of or the day after your surgery that you're all recovered, but it can take 4, even 6 weeks to feel back to normal. So if pregnancy is part of your future plans after having endometriosis surgery, it's worth having a clear discussion with your surgeons before the operation. In many cases, removing endometriosis can improve fertility, especially if it was affecting your ovaries or blocking your fallopian tubes. And most doctors will recommend waiting at least 1 full menstrual cycle after endometriosis surgery before you try to get pregnant to allow your body to heal. And if your surgery involved extensive dissection or some repair, you might be advised to wait a bit longer. It's also worth asking your surgical team in advance if a tubal dye test can help to visualise the fallopian tubes and can be done at the same time as your surgery. And this test checks whether your fallopian tubes are open and can give you useful information to guide your next steps, particularly if you're struggling to conceive. So here's my top tips for recovery after endometriosis surgery. Firstly, you should rest, but do move a little each day. Short walks around the house can help to reduce the risk of blood clots and ease your bloating by helping the gas to come out. Chew gum. Anything with peppermint, like peppermint tea, and gently moving can help to release that trapped gas. You should take your pain relief regularly at first. Even if you feel okay, it's easier to stay on top of your pain relief, taking it every 3 to 4 hours, however it was prescribed, rather than chase it, so allowing that breakthrough pain to occur. So at least for the first week, take painkillers every few hours regularly throughout the day. It can be a good idea to wear loose or even high-waisted clothes. Avoid tight waistbands. You're going to want some soft, stretchy layers. You should keep your bowels moving because constipation after this kind of surgery is common. Stay hydrated, that's number 1, and eat fibre. And if you need to, you can ask your doctor to prescribe a gentle laxative. And ultimately, you should plan to give yourself a restful time. If you can, organise time off from work and get some support at home. Even though you might feel fine one day, you can feel completely wiped out the next. So going straight back into your normal activities may not be the best idea. Listen to your body, because everyone heals differently. You shouldn't compare yourself to other people, how they recovered from a laparoscopic surgery. Your recovery is your own. And most people find they need about 2, 3, or even 4 weeks off of work after having a laparoscopic surgery, but you can discuss this with your doctor. Also, keep a close eye on your symptoms after surgery. Track your periods closely, especially after the first few cycles, so that when you have your follow-up, you can tell your doctor how that recovery's been going and plan any other treatment you might need. Surgery for endometriosis ultimately isn't always a cure, but for many people it does bring real relief and a better quality of life. So what matters most is that you feel heard and supported in your endometriosis journey and allowed to make those decisions that are right for you. If you found this video helpful, please do give it a like or share it with someone else who might be planning for endometriosis surgery. And if you've already had surgery for endometriosis and you want to share your recovery tips or your experience, please pop them in the comments below. Your story could make a huge difference to someone else.